Fever is considered an obligatory manifestation of Kawasaki disease. There should be no other explanation for the fever, and while there is some leniency in regards to the duration, it is expected to have been present for at least 5 days. While there is a large variety of manifestations that are caused by Kawasaki disease, only 5 signs of mucocutaneous inflammation are included in the criteria. Within the first few days of illness, children may develop non-suppurative anterior cervical lymphadenopathy. There can be redness of the overlying skin, but pain and tenderness do not usually occur. At least one lymph node greater than 1.5 centimeters in diameter is required for the diagnosis, and in actuality, only a single lymph node is usually enlarged. Diffuse lymphadenopathy and splenomegaly are uncommon and should put the diagnosis into question. A rash may begin on the trunk and then spread to the rest of the body. If an antibiotic was administered, then it may be erroneously attributed to an allergic reaction. The rash is usually maculopapular and erythematous, but a variety of types may occur, such as erythema multiforme or a morbilliform or scarlatiform rash. Vesicles and bullae, however, do not usually occur. The conjunctival injection associated with Kawasaki disease typically begins within days of onset. It is usually bilateral, bulbar with sparing of the limbus, and non-exudative. Although painless, there may be photophobia, and uveitis, when present, should increase suspicion of Kawasaki disease. Mucositis develops as Kawasaki disease progresses. There may be marked erythema of the lips, pharynx, and tongue. The lips may become swollen with cracking and bleeding, and the erythema of the tongue in combination with swollen papillae can give an appearance often described as a strawberry tongue. About 1 week into the illness, the hands and feet may become diffusely swollen with erythema of the palms and soles. Desquamation of the skin occurs about a week or 2 later. If the fever criteria and 4 or 5 of the clinical criteria are met, then the diagnosis is established. Now, if a clinician has a great deal of experience in treating Kawasaki disease, then the diagnosis can be established prior to the 4th day of illness.